Okay, let's dive right into this source you've shared with us. It's all about navigating those essential health conversations, in English, specifically when you need to see a doctor. Think of it as a sort of linguistic toolkit for the clinic visit.
Yeah, absolutely.
So our mission today, take this source, unpack it, and really pull out the key phrases and insights, the absolute nuggets you need to feel confident when you're talking about your health in English. Because, let's be honest, when you're not feeling well, clear communication is just...
Yeah, it's everything.
It really is. And what's so valuable about this source, I think, is its practical focus. It doesn't just give you words in isolation.
Right.
It grounds them in the actual real-world scenarios of a doctor's visit.
Right.
Understanding these specific phrases is incredibly empowering when you need to describe how you feel or, understand what the doctor's telling you.
Right. So where do we even begin? Well, the source logically starts with the absolute foundation. The basic vocabulary, the terms you need just to sort of identify the players in the general situation. All right, it lists the key people like doctor, nurse, patient, and the essential concepts, things like appointment, symptoms, fever, headache, stomachache, cough, cold. These are your real building blocks.
Yeah, absolutely. And the source gives us some quick, simple examples just to show how these terms slot into sentences you'll actually use. Like, I have a headache and a fever. Simple, direct, necessary. Or the crucial, I need to see a doctor. That's often the very first thing you have to get across.
It's true. Knowing these fundamental terms is really the jumping off point. They establish the setting and, the initial problem. You can't really get started without them.
Okay, so you've got the basic words down. The next logical step the source takes us through is actually getting in to see someone you know, making the appointment.
Yes. The practicalities. This is where the source provides really actionable language. How do you even start that call or conversation? It gives us phrases like, I'd like to make an appointment. Direct, polite.
Right.
Or, if you need to check availability, when is the doctor available? Pretty straightforward.
And what if you're feeling really unwell? Like you need to be seen soon.
Yeah, the source covers that too. I need to see a doctor today. Or asking specifically, perhaps, is there an opening this afternoon?
And the source even walks us through a simple but perfect example of that back and forth. Like, imagine you call the office, hello, I need to see a doctor.
And the response might be, when would you like to come?
And you might say, today, if possible.
And hopefully they say something like, okay, we have an opening at 3 p.m.
That little exchange is gold, isn't it? Because it shows you the flow. It sort of demystifies that initial contact.
Exactly. You state your need. They ask about timing, you state your preference, and they offer an option. These specific phrases, they just cut right to the chase, which is exactly what you want when you're trying to get help.
All right, so you've successfully navigated booking the visit. Now you're actually in the examination room. And the core task is describing how you feel. This section of the source is, well, vital.
This is where precision really matters, isn't it? The source starts with a general phrase like, I don't feel well, which is fine, a good start. But then it gives you ways to get specific. Things like, I have a sore throat, or I've been coughing a lot, maybe I feel dizzy, or I've had a fever since yesterday.
Oh, right. Notice how that last one includes a time frame. That's key information for the doctor.
Absolutely.
Yeah.
The examples reinforce this need for detail, too. I have a stomachache, or my back hurts. Instead of just saying, I hurt, you can specify where.
Yeah, or like, I've been feeling sick for 2 days. Again, adding that crucial duration.
What's fascinating here, I think, is how learning these specific combinations like noun, verb, or adjectives dramatically improves your ability to convey exactly what's happening. Sore throat is obviously very different from a stomachache, and the doctor needs to know which one it is. Getting these specific phrases right directly impacts their ability to understand your condition.
Okay, so you've told the doctor what's wrong. Now the tables turn slightly. The source moves on to the questions you are likely to hear from the doctor.
Right. This is the diagnostic phase. The doctor needs more pieces of the puzzle. So according to the source, you should be prepared for questions like, what are your symptoms? Basically asking you to repeat or maybe elaborate a bit.
Yeah.
When did it start? Establishing that timeline we just mentioned. Do you have any allergies? That's critical safety information.
Oh, definitely.
And are you taking any medicine? Again, really important to avoid drug interactions or just understand existing conditions.
And the source provides a pretty realistic snippet of this interaction too, doesn't it?
It does. Like the doctor asks, what brings you in today?
And you might use one of your symptom phrases. Well, I have a headache and feel tired.
Then the doctor probes deeper. Do you have a fever?
And you can respond with that time frame. Yes, actually, since last night.
Understanding why they ask these questions, to build a complete picture for diagnosis, it helps you anticipate them and prepare your answers. It shows the flow of that medical interview. They ask, you provide the detail.
Makes sense. Okay, finally, assuming you've discussed symptoms and answered all the questions, you'll get instructions. This last section from the source is, well, arguably the most critical part for a successful outcome after you leave the clinic.
Definitely. Misunderstanding treatment instructions can have, serious consequences sometimes.
Right.
So the source gives us the language doctors often use here. Things like, take this medicine twice a day. Simple, clear dosing.
Right.
Or rest and drink plenty of water. That common practical advice.
Standard advice, yeah.
You need to take a test, explaining the next step perhaps, or setting expectations. Come back if you don't feel better.
And the examples really nail this clarity. Take one pill every morning. Totally unambiguous dosage and timing.
Exactly. Or the simple command, you should stay home and rest.
Yeah. If we connect this to the bigger picture, correctly following these instructions is just fundamental to recovery, isn't it?
Absolutely. Having these phrases from the source helps ensure you don't miss vital information about your treatment plan or, any follow-up that's needed.
So what does this all mean? We've basically used this source to walk through the essential communication steps of a doctor's visit in English. From realizing you need help to understanding how to get better. The source grounds us with basic vocabulary.
The building blocks.
Then builds through making the appointment, clearly describing your symptoms, understanding the doctor's questions.
We're at the back and forth.
And crucially, comprehending the instructions you're given at the end.
It really pulls together all the pieces you need to function effectively in that specific, sometimes high-stakes environment. Having these phrases and understanding these scenarios all directly extracted from the source, it equips you with the confidence to handle what can be a potentially stressful situation, especially in a language that isn't your first.
It truly empowers you, doesn't it, to advocate for your own health needs.
Exactly.
And as the source reminds us, the real value comes from actually practicing what you've learned. So based on everything we've just pulled out of the source, here's maybe a final thought for you, the listener. Think about which specific phrase or scenario from this deep dive feels the most challenging for you right now. Or perhaps which one feels the most immediately useful for your situation.
Mm-hmm.
Why might focusing your practice just on that one thing make the biggest difference for you first? Something to consider.